Hey guys, today we are here with Brooke from Her Health Physiotherapy in Sydney, and we have come to chat all things perineum actually, after lots of questions about what on earth a perineum is and why you even need to think about it before birth. So, Brooke, thank you so much for your time and for having us in your beautiful practice this afternoon. Why don't we start with what on earth is the perineum?
So the perineum is the piece of tissue in between the vagina and the anus. So if we have a look at it on the diagram, it's this piece of tissue right here. And it's unfortunately very prone to tearing during labour because everything has to stretch so much. And so that's why we try and manage it with a couple of techniques that we'll talk about today.
Oh, okay. So, what is your first technique that you give your woman to help try and prepare the perineum for labour?
Yeah, so one of the biggest things that we do is perineal massage. And so as the name suggests, it is massage of the perineum. Which we can go into depth about the whole process of how women do it. It is one of those things that the more you do it, the better you get, and it's not something that many women love doing, but it's really helpful for a lot of women to understand what the stretch feels like for labour and for crowning, and it really helps prepare them for that sensation and to relax it and lengthen.
Yeah, perfect. So, when do women start to need to prepare and do this perineal massage?
Yeah, so they can start from 34-35 weeks, provided their obstetrician has said it's safe to do so, and that's when the research has shown that it's most beneficial, so later on in that third trimester.
Perfect, right, so what does it involve?
So there's a few steps that we like to take for perineal massage. Number one, we want clean hands, that's the biggest thing. So we clean our hands first. Finding a comfortable position to lay down in is really important as well, because if you're sort of manoeuvring your body in all sorts of weird positions, it's hard to relax. So finding that comfortable position. Then what we can do is women can apply a warm compress, like a heat pack, just to the area over the top of the clothes initially, and then they can start the massage. So usually I recommend about 5 to 10 minutes of heat beforehand. And that can be that heat pack, that can be in a warm shower, just to allow everything to lengthen. And then what they can do, either themselves or their partner, it's up to them what they feel more comfortable with. But basically what we're doing is we're inserting either 1 or 2 fingers inside the vagina, just about 1 or 2 centimetres. So we're going in towards the vagina, pressing down into the perineum, and you'll feel a bit of a stretch, maybe a little bit of a tingle, almost a sting sensation, and that's when you've done enough. So just that bit of a stretch, and then we're scooping in a U shape, just stretching that perineum for about 2 minutes. Have a break and then go again.
Okay, perfect. And so other than heat, do you ever recommend women use any lubrication or anything like that to help?
Absolutely.
As well?
Absolutely, it's necessary. So plenty of lubricant. Things can be still a little bit dry later on in pregnancy. Most women find they have a lot more discharge, so they may not need as much, but use it to your comfort.
Okay, and then in terms of the stinging factor, what do you recommend? Is it sort of go to a point and see how you feel afterwards, or
Yeah, so gentle with what they can tolerate. They should still be able to breathe through it. If it's too intense, they'll clench and tighten, and that's counterproductive to what we're trying to do. So if they're doing it, just to where they can feel a gentle stretch. If their partner's doing it, same thing, but they need to let their partner know when is enough, and just sort of stay at that pressure and do the massage. And if it's feeling okay, they can go a little bit more.
Okay, and how frequently and how long do you usually recommend women do this for?
Yeah, so I would recommend they do it as often as they can, which for most women they go, oh, I'd rather not. So usually once to twice a week, and the research has shown that that amount is totally fine. And if they can tolerate 2 to 5 minutes. And if they need to go in short bursts, so a minute at a time, have a break, or if they can do 2 minutes at a time and have a break, whatever they feel more comfortable with. And the more they've been doing it, the longer they'll be able to tolerate.
Okay, perfect. And so when women go into labour, contractions can be uncomfortable. And normally with any form of discomfort, we tend to sort of want to contract against it. So I'm wondering what tips you give women to try and help that perineal area stay as relaxed as possible against all of the body's wanting to stop the contractions.
Definitely. So the perineal massage can certainly be done during labour as well, provided women feel comfortable with that happening and don't want to kick their partner away. So that's one option, but one of the other options is having that warm pack that we spoke about earlier, just over the perineum, just to help those tissues relax a little bit more.
Okay, and so would they be using that initially when they're initially feeling the contractions? How long through the labour process would you still recommend using that compress area around that perineal area?
They can use it the whole time if they feel comfortable doing that. Usually I recommend women move around as much as possible, so if they're in a position where it's possible to have that little bit of warmth on them, then that would be perfect. If they're up and moving, it makes things a bit trickier, but it's really down to the woman's comfort.
Okay, perfect. So the I know we mentioned before you were with the massage, you were wanting to warm the area first, so you recommend showers before, or what do you normally recommend with your before the massage?
Yeah, so warm shower can be good. If women are comfortable having a warm bath, provided it's not covering their tummy, then that's fine as well. Otherwise, heat packs can be fine, always over the clothes though. And hot water bottles, if that's all they've got at home, that can be useful also.
Okay, cool. And then also as you know, the Pelvic Hub has these beautiful perineal soothers that we have brought into Australia and New Zealand, and they can be warmed up with warm water and used before perineal massage or during labour in your underwear if you're wanting to move around, and then afterwards you can just put them in the fridge or freezer and use them for recovery. So that's just another option to keep in mind.
Yeah, twice the benefit.
And well, thank you so much, Brooke, for sharing all of your knowledge with us today and for having us here at your beautiful practice at Her Health Physiotherapy. I'm sure that we are all so much more knowledgeable about perineal massage and the importance of helping that perineal area relax during birth, and hopefully all of you will be out there now getting super excited at what week is it?
34, 35.
Week 34, 35, guys. Get excited. Perineal massage. Thank you.